Hi, I'm Dr. Grigoriev. You are probably watching this video because your physician recommended that you undergo robotic surgery at Mountainview Hospital. Robotic surgery has become a very important alternative for treatment of many different conditions. Robotic surgery is performed by general surgeons, gynecologists, urologists, ENT surgeons. And today I'm going to tell you a little bit more about how robotic surgery is performed here at Mountainview Hospital. Come with me and I'll show you how a robot really works.
The Da Vinci SI system is a state-of-the-art, minimally invasive robotic surgical solution that can be used under the guidance of a trained surgeon to treat numerous conditions. With the Da Vinci SI surgical system at Mountainview Hospital, surgeons operate on the patient through just a few small incisions that are referred to as ports. These ports are then used for high-definition video cameras and tiny wristed instruments that can bend and rotate with far greater flexibility than the human wrist. Las Vegas urologist Dr. Victor Grigoriev tells us more about it.
Surgery is performed through 3 or 4 small incisions in the body, and the instruments are then inserted. One of the truly remarkable instruments is a surgical camera, which allows a surgeon to have a 3-dimensional view and also 10 times magnification. The camera and the optics that are used are truly remarkable as well. Not only are they high definition, but they allow 10-time magnification and 3-dimensional view of your body.
The advantage of the robot surgery is because of its magnification, it is control or improve the nerve preserving and also saving the urethra better, and the urinary incontinence is minimal.
Once a patient is properly positioned and the trocars are placed into the ports, the surgeon sits comfortably at a control console located just a few feet from the patient. The surgeon then uses hand and wrist controls that translates his or her hand movements into smaller, more precise movements of tiny instruments inside the patient's body. The surgeon's feet are also used to control foot pedals that can be used for drilling, burring, or cauterizing tissue. It's important to note that the surgeon is in control of the robot 100% of the time.
The Da Vinci robotic system is really not a robotic system per se. I think robotic is a misnomer. This machine behind me can't be programmed to do anything. It's not like the standard robot that you would program to do a function. That machine just really duplicates a surgeon's movements inside the body.
As you can imagine, it takes a great deal of competency to utilize the Da Vinci system. And at Mountainview Hospital, we require a high level of training from our surgical staff that includes nurses, the scrub technicians, even the anesthesiologists and the physicians and physician associates go through training to use the Da Vinci system.
One of the advantages of Mountainview Hospital, the people who are working in the Mountainview Hospital, they are dedicated for this robot surgery by hiring a specific manager and director for this robot surgical team. They also hired better surgical assistants, nurses who are only dedicated for the robot surgery.
As a result, the Da Vinci enables our surgeons to perform routine and complex surgeries with a level of dexterity and repetition unmatched by traditional open or laparoscopic surgeries.
The postoperative period after robotic surgery is a much better experience than previously when we were doing open or laparoscopic surgery. There's much less pain postoperatively, recovery is much faster, and return to work is a lot quicker.
So with 2 complete Da Vinci SI systems and a highly trained staff, Mountainview Hospital is changing the surgical experience for the people of Southern Nevada.